Hello everyone, this is Dr. Swapnil Chandratre here. Lot of the aspirants have this query regarding and they have anxiousness regarding what will be their future if they come to Germany. Because in a KP exam there is only 3 trials and what if they don't pass this exam? Well, I would first say that till now the passing rate by the end of the third trial is around 90%. Only 10% of the people are not been able to pass this exam in 3 trials, which is I would say compared to other countries like Canada and Australia, that is the passing rate only 10%. So compared to that is very good here. But still people will have that question that what are the options. So because of so many times that was asked, I have decided to do some research on that, and I have come up with some of the ideas. I have talked with many people who have gone through it, and today I'm going to discuss these things, that what you can do if you fail the KP exams 3 times. And if you haven't subscribed to the channel, please subscribe to it, because such information you will not find anywhere. So let's get started. So if you fail KP exam 3 times, you will feel that is that the end of the road for you? Is there no another way to become a dentist here, or you cannot work here, or you cannot stay here in Germany? Do you have to go back to India again? What are your options? Well, I would first clarify that if you fail your KP exam 3 times, you cannot give that exam fourth time. Okay, so if you are failed in the exam 3 times, you cannot apply again. Okay, it's not like that. Okay, you have failed an exam in one state, then you apply everything from beginning in other state, and then you give KP exam in other state 3 times. That doesn't work like that. So it will be done and dusted. But there are some options which you can go through it. We'll discuss right now. The first option is go to Austria. Now, why I have told Austria is that Austria is also a German speaking country, and the other European country will speak their own language. So you have to, if you want to go to another country like France or Netherlands or something like that, then you need to learn their language also. But in Austria, with only German language, you can go there. You already know the German. If you have gone through with the KP exam, by the time you will be fluent with the German language, so that language part doesn't come. And there you cannot go directly. The system is like that. In Germany, our degree is valid, so we don't need to study again. We just have to give exam and pass the exam. But in Austria, our degree is not valid. Just like US, you need to study again. But here is the catch. If you show that you have gone through this documentation process, or you have deficient Bescheid from Germany, and you have passed the FSP exam, then you have appeared 3 times the KP exam, and you were not able to clear it, then all this documentation will allow you to give an entrance exam. So ideally this study is for 3 years, and this entrance exam you have to give. In that it's like around 10 to 11 subjects. These subjects will be like prosthodontics, endodontics, oral diagnosis, and all those our dental subjects. And there will be MCQ exams, and that's like a knowledge exam for you. So based on your result, they will tell that which of the subjects you need to repeat. And I have heard that with that passing at a good score, that study is reduced to only 2 years. So after this you need to repeat those 2 years in their university like a student, and once you done with that, you will get an approbation or a permanent license. With that approbation, you can come back to Germany and work directly as a dentist. You don't require to then to give KP exam. With that approbation, you can work in Austria also, in Germany also, in other EU countries also. So that is the good option. But as I said, you need to have these documents to get there. Another thing I have heard from people, that this university, those classes you can learn online also. So if you are staying in Germany, and if you feel that okay, I'll sit in Germany, I will work in Germany, maybe after the classes, and I'll attend the classes in sitting at home online, then it is also possible. But you will need to have one address in Austria. So with that, university can contact you or send you some letters or official stuff. So if you are in that situation, if you come into that situation, you have to find some contact there, who can collect your stuff and who can be the responsible for you. So that is also little bit flexible. So that is a good possibility, and with that you can follow your dream to become a dentist. It's like just 2 years extra, that's it. And that's a good option. The option number two. The option number two is that you can choose a dental hygienist pathway. So how does that work? Well, basically before sometime I was in that frame that if we fail in a KP exam and if we want to go for a hygienist pathway, then we need to do that hygienist pathway entirely, that 3 years of this training and all that. So that will prolong the pathway, but it's not like that. I have talked with some dentists also, and it's more of like a private thing. So for example, if you have worked in some dental clinic for 2 years as assistant dentist, then that dentist knows that you know the system, you have worked with them, you have helped them. So if any case you fail the KP exam, they will directly hire you as a dental hygienist in a clinic. So it's like for them, they are getting a good work, good dentist work with the salary of dental hygienist. So you don't have to repeat do study that or do that training. You can directly work as a dental hygienist, and after that you can do some specialization in hygienist. There are some specialization like for example, if you do a prophylaxis assistant for 1 year, if you study, then you become a specialist for the perio treatment, where all the periodontal treatment are performed by you only, like curettage and all that. So you'll be like a perio specialist. There is also another branch which is a non-clinical one. So if you want to become a practice manager, so here there are big clinics, so they want and they look for the practice manager. So what you do is that you manage the staff, you manage the patients, you talk with the patients, you do salary work of the staffs, interviews, and do treatment plans, and costing stuff and all that. So that paperwork thing you can do also, and with that you can earn a good amount. So it's like around you can earn at least up to the assistant dentist salary with that also, and also with the prophylaxis assistant. So with that yeah, of course you cannot work as a dentist, you cannot open your own clinic and all that stuff, but see, end of the day you can earn more than 80% of the dentists who are working as a dentist in India. So that's again an advantage, and you get to have all the social benefits like health insurance and child education and pension program, and all those benefits you will also get. So and you get to stay in a European country and good life, work life balance and all that stuff also. So that is also not a bad option. So there is not an end of the road, you can choose that pathway also. The option number 3 is that to change your line. So it's like if you want to change your profession, that okay, now you are done with dentistry and you want to start something or you want to work something, then yeah, there are many training programs are there. You can go for it. You can apply in some university and do some course and convert your thing. So it's not like that if you don't want to do your profession and you want to change it, then you can do that anyway, like some people are doing public health and something like that. So with that direction you can also think about it. I personally don't have too much knowledge regarding how to change your branches and what comes with the visa scenario. So I am not going to discuss it too much, but that is also a possibility. Those who are staying as a on a dependent visa, they don't have issue with the visa or staying status. They can choose this changing profession thing also. So for them it is little bit easier. And coming to the option number 4, the option number 4 is go back to your country. Now when I say this, there is always a taboo in our country, especially in India, that you have come back to your country after going to foreign country. Then people will there's too much of the social pressure and what will people think and all that stuff. So I would like to first say regarding that is in dentistry it is not that common to do fellowship for longer time in outside India and then come back to India and your practice. In medical it is very common, people are going since years for they do that 1 year 2 year and they go back to their country and do their clinic. So you can think it like that, that you are you are training yourself. You are obviously in these 2 to 3 years you are going to upgrade yourself tenfold. So by and these things are not going to get wasted, right? So when you go back to for example your country, or if you go back to India, so then you will have enough money. By the time these 2 3 years you will save enough money to open your clinic, or and the experience which you will learn here, okay, the dentistry, if you are able to get a job in a good practice, then the amount of work and type of work which you are going to do, that will elevate your practice tenfold. So you that it's not like that it's a loss for you. You just always have to think the amount of year that are invested into the process compared to the remaining years which you are going to practice. So with that in mind, you always have to think that even if you fail the KT exam, that's not a end of the road. That's not going to finish your life or anything like that. So don't overthink about it. As I said, till now the passing rate is around 90%. So try to work hard, try to work smart, do good documentation, take a good professional help. If you have any question regarding which way for you is the best one, which way you should come, how to do good documentation and all that stuff, you can contact me. The link is in a description box. And yeah, this is what I know and what I can say and what I can suggest. These are the options you can choose. With that you can stay relevant to your line also, and you don't have to worry about anything. So I hope that everyone likes this video and information, and till then, have a nice day.